The emergency department is transitioning to dynamic documentation. This will impact the nursing discharge process. In this tutorial, we will explore the use of the nursing discharge end page. How will the discharge process change? Many of the discharge requirements remain the same. However, the manner and location in which you complete your discharge workflow will change. Nurses will still be notified of a discharge order by the open door icon located in the status column. In the past, users would right-click while in LaunchPoint to access the discharge process. This feature will be going away. Going forward, nurses will utilize the Discharge Admit end page via Viewpoint to complete the discharge documentation. To navigate to the nursing discharge end page, we will begin by entering the patient's chart. Next, we will navigate to Viewpoint. As you can see, multiple end pages are available for documentation. For the nursing discharge process, we will utilize the Discharge Admit tab. In the event that the tab you are looking for is not available, it can always be added by clicking the plus sign and making further selections from there. On the left-hand side, you will see the series of discharge components. Many of these components will auto-populate with information that has already been entered by the prescriber, as shown here. Required components are denoted with a red asterisk. After that requirement has been completed, it will change to a green check mark. Users have the ability to reorder components if desired. That can be done by selecting the component, dragging, and dropping. The discharge diagnosis will be entered by the prescriber. From this component, the nurse has the ability to visualize this visit versus chronic problems. This is considered a read-only component for nursing. Patient education is selected and added by the prescriber. From this component, the nurse has the ability to review the information the prescriber has selected. This information will populate into the discharge summary automatically. In the event that something needs to be added, that can be done by clicking the plus sign, searching, and adding from here. At least one follow-up entry is required for discharge. The follow-up plan will be selected and added by the prescriber. From this component, the nurse has the ability to review the information entered by the prescriber. This does not schedule the actual appointment. That still needs to be done manually. In the event that additional information needs to be added, that can be done by clicking the plus sign or by searching for providers via the search bar. If nursing follow-up has been arranged, such as VNA, you can add to this field as well. The patient instructions component is unique to the nursing discharge workflow. From this component, the nurse has the ability to free text information to provide to the family. For example, this is a great opportunity to add additional information regarding medication dosing or the next time a dose is due. For ease of documenting, this component can be pulled over to the right-hand side. That can be done by pressing the minus sign to zoom out, where you have access to this arrow icon. Clicking it pulls the component over to the right-hand side. The home medication component will pull information from the prescriber's discharge medication reconciliation. Additional details can be found here, including compliance and supply remaining. Prescriptions that are new to the patient will also be listed here. This is considered a read-only component for nursing. The order profile component allows the nurse to review the orders that have been placed for the patient this encounter. Orders are grouped by category. If you would like to filter further, that's possible by selecting from the drop-down. Here you can titrate based on medications, future orders, or inactive orders. The outstanding orders component allows the nurse to review orders that have not yet been completed. If there are outstanding orders, please review with the prescriber if those orders are still needed or if they can be canceled by the provider. The IV stop time component allows the nurse to document the completion of an IV directly from the end page. To do so, the nurse would click Document and finish their selections. The vital sign component allows the nurse to review the most recent set of vital signs before discharging the patient. Additional look-back options include last 24 hours, last 7 days, and last 4 weeks. In the event that the nurse would like to document an additional set of vital signs before discharging the patient, that is possible directly from the end page by clicking the plus sign. Upon doing so, it will link you directly to the flow sheet where you can enter the vital signs. The Documents component allows the nurse to review any documents that have been written on the patient. Different look-back selections include selected visit, last 72 hours, last 7 days, and last 4 weeks. Here, notes will be broken down by in progress versus completed notes. It's now easier than ever to complete the ED disposition power form. That can be done directly from this end page component. In order to access it, we will click the down arrow and select ED disposition. This will generate the familiar power form that is needed for discharge. The nurse can go through, fill out the components, and click the green check mark to complete. After completing all of the required documentation, the red asterisk will be replaced with a green check mark, as shown here. The next step is to refresh the note. That can be done by clicking in the upper right-hand corner of the page. This is important because it ensures that the most up-to-date information is being pulled into your note. After refreshing, we will tie the components to a note type. To do that, we will click on ED Discharge Summary under Create Note. This next window gives the nurse the opportunity to review the information that has been pulled into the discharge summary. As we scroll through, you can see that the individual components are pulled into the note. There are a few opportunities for the nurse to add additional information should they choose to do so, such as under Additional Instructions as shown here. The majority of documentation should occur on the previous pages in the individual M-page components. As we scroll through, you can see specific information such as the educational materials previously selected will populate into this automatically. In addition, there will be information included regarding the My Children's portal, the discharge checklist, otherwise known as the golden ticket, as well as a school work release note. There are a few options available depending on the next steps. Prior to moving any further in the discharge summary process, it's important to refresh the page. Again, this ensures that the most accurate and up-to-date information is being pulled directly into the discharge summary. In order to terminate the discharge summary and begin printing, we would click Sign and Submit. Otherwise, we can save or save and close the discharge summary to return to it at a later time. After clicking Sign and Submit, you will be brought to the Sign and Print page. Here, by clicking Sign and Print, you will be able to proceed with printing the discharge summary. After clicking Sign and Submit, you will be brought to the Medical Record Request window. From this window, we can preview or send. By clicking Send, it will send the discharge summary to the mapped printer and it will print automatically. When it's time to check the patient out, this can be done directly from the Discharge Admit End page. The option can be found all the way at the bottom under End Visit. Clicking the Checkout button will drop the patient from the bedboard as in previous practice. The Transfer button should be avoided. After the patient has been checked out, a green check mark will appear next to Checkout. In the event that the nurse needs to document additional information on a patient that has already been checked out and removed from the bedboard, the patient can be accessed via the Checkout tab. By clicking here, you will have access to the patient's chart. If you're looking for additional resources or information, please visit the CHAMPS ED page. From the website, you can sign up for a virtual demo. In addition, there are How Do I documents available. As always, with any questions, please feel free to send an email to the CHAMPS Clinical DL.